How do you keep your loved one out of the hospital or another institution if they're generally homebound or bedbound? This is a typical question I get from patients and families. I'm Bienstock, and I am a board-certified plastic and reconstructive surgeon. I specialize in wound care, and I take care of patients in their home. So how do you keep your loved one at home and prevent them from being hospitalized? I'm not a huge fan of hospitals for chronic patients in terms of disease or they're homebound or bedbound. The reason is hospitals are great at treating acute problems such as heart attacks, strokes, pelvic fractures, hip fractures where you need an operation, but they're not the best places, particularly in New York City, in terms of managing chronic issues. Whether you need IV fluids, dehydration, a lot of these things can be managed in the home. So how do you keep your husband, your wife, your aunt, your grandmother, your grandfather at home? You need to have a great team. That's the most important thing. Having a great team requires a lot of work, which means having a primary care physician, having a nursing team potentially, as well as having care providers such as caregivers, and you have to coordinate the care. That becomes the most challenging things. How do you coordinate everybody and to be collaborative? This becomes challenging in the American healthcare system, is having a non-fragmented effort. So you as the family member have to really be on top of all of the caregivers, all of the primary care providers, the specialists who are taking care of your loved one. This is where it becomes challenging because managing all that sometimes can be a full-time job. So if you want to keep your loved one at home, you really have to have a coordinated effort with all your family members, your spouses, your brothers and sisters, to keep your loved one, whether it's a mother, father, grandmother, or grandfather, at home. And managing this becomes challenging in terms of all the medical issues, all the medications, which means you have to be organized, have spreadsheets. You should have all the insurance cards printed up on the wall. You should be talking to the caregivers on a weekly basis and making sure there's good communication links between you, the caregivers, the primary care providers, the nurses if you require a nurse for wound care or other avenues such as bladder control, Foley catheters. And this is where you could spend a lot of time, but all these efforts you put in will make a huge difference in keeping your mother, your father, your grandmother, grandfather at home. And your loved one will do much better at home with a good, we'll call it a hospital environment in your own house. If you have any questions regarding this, please feel free to contact me. And when you get a chance, subscribe to the channel. Thank you.